Hello. This is Braden. Braden needed a new heart. Braden was born in 1993 with a congenital heart disease. He had 2 holes in his heart that would require surgery. His parents were told his best chance of survival would be a heart transplant. After 5 weeks, Braden was finally told that he got to have a new heart. His mother recalls it was the most beautiful day to see how red his lips and fingertips were after the transplant, all because of one family's choice to make the unselfish decision to donate their son's organs. Be an organ donor. Give life to someone else. What is an organ donor? Be the donor and be the recipient are the first things we're going to learn how to do. What is an organ donor? Anyone, regardless of age or medical history, can sign up to be an organ donor. There's no cost to the donors or their families for organ or tissue donation. People can recover from comas, but not brain death. Coma and brain death are not the same. Brain death is final. This means that just because you're in a coma in the hospital doesn't mean that you're brain dead. Brain dead is final death. That means releasing someone from a ventilator or what have you and their brain waves are not working. That makes someone good for an organ donation. To be the donor, you have to register to be an organ donor at www.organdonor.gov. Why should you donate an organ? This can save someone's life. Just because your body is a shell and you have good organs left, you can donate and give someone extended life. Organs that can be donated include kidneys, heart, liver, pancreas, intestine, lungs, skin, bone, cornea, and bone marrow. This can come from a living donor or a deceased donor. A living donor is someone that can donate a kidney or bone marrow. Be the recipient or friends of family of someone who is. Transplant data shows that more and more people receive transplants every year, and that many people with transplants are living longer after receiving their organ than ever before. They've made many modern advances in medicine in order to make these organ transplants work. The first transplant was done in 1954 of a kidney transplant. Patients may have medical conditions that make it harder to find a good match for them. Some conditions that may make it harder are known diseases that they cannot get on the list right away. They may have to cure a disease first, or they're a lot more sick than other transplant people are. And what would you give for one last year? What would you do if you were told you had 1 year to live? Wouldn't you want more than 1 year? Organ donation can give you many years, potentially, when these people will have maybe 10 days or 1 month. Be an organ donor today. Again, brain death means your body is a shell full of healthy organs that just may give someone a 4th birthday. Will it be you? He says, "Thank you, I have a new heart because of you. I had a great 3rd birthday." In conclusion, it's best to be an organ donor because you can give the ultimate gift. Many people are on a waiting list for organs. There are more there are more people waiting for organs than there are donors. We need more donors for organ transplantation. Thank you.